So today we're talking about the Health and Safety Index. It's really exciting for us. It's been a couple of years in the making, and over the last few months in particular, thousands and thousands of people have been involved to give us some data that we're here to share today. So one of the reasons why the Health and Safety Index came about, it was really based on market need. There's a certain amount of frustration from myself and other people I have been speaking to in the past that often employee engagement surveys was trumping safety, and not always, but often safety was not considered, or if it was a bit of an afterthought. So what we've done is we've flipped that concept on its head, and we've created a health and safety assessment that also integrates engagement questions, whereby giving people an ability to integrate not only the assessment, but the outcomes, and drives the collaboration between different stakeholders, in particular, or typically, HR and health and safety professionals. So I'll hand things over to Kate, and she can quickly run through what we're going to be covering today.
Excellent. Thanks, Mark. So we've essentially got 40 minutes to cover off the content today. So we're just going to start with getting a little understanding around why you're here and what you're wanting to learn around the Health and Safety Index, and particularly the results that we've garnered over the last couple of years. We're going to go through the model that we use in terms of mental health and wellbeing, which is the job demands, job resources and worker outcomes. We're really excited to take you through the results thus far with a range of clients, both within Australia and overseas. And we've got some case studies to give you some really practical takeaways and learnings that we can share. And then we've got an offering at the end that we'll go through when we get to that point. Thanks, Mark. So Sarah, poll number one, thank you. So we'll just give you a moment to respond to that question. What do you want to hear today? It's saying hosts and participants, panelists cannot vote on the bottom of that poll, Sarah.
Everyone is voting, so
okay,
maybe. Well, I can see they are. It's so I don't know why it would say that. Anyway, 83% have voted. We'll just give it a few more seconds, and then we'll share those results, which I think I'll do right now.
Excellent.
There you go.
Practical takeaways is the key. Interesting. Excellent. Okay, well, we can certainly provide that as we get to a bit later in the session. And yeah, keen interest obviously too on the actual results, taking a risk-based approach. So we've definitely got that covered. Excellent. Thank you very much for your participation in that. Thanks, Mark.
Okay, so with that in mind, we'll zip through the introductory slides and really cut to the chase around some practical takeaways. So a little bit about us is FIFO Consulting is a risk, health and safety consulting firm. The Health and Safety Index is more of a product which enables organisations to measure, to focus and to act on things that they believe are important based on feedback from their organisation. We do have a multidisciplinary team scattered across most capital cities in Australia, made up of senior experts. In particular, as it relates today, we're talking about health and wellbeing. We have Kate, who's had loads of experience in frontline mental health roles, and Sally, who has a psychology background. So I won't bore you with any more of the details about us, but more around what does the Health and Safety Index actually measure. So the Health and Safety Index is more than just a safety climate survey, or more than just a traditional or typical survey. It covers off four key aspects: safety leadership, so in particular the behaviours that individuals are demonstrating; safety engagement, so looking at some of those drivers across the organisation that drives high performance cultures; safety systems, so it's not an audit, it's not focusing on compliance and process, it's more around user experience and access, ready access to the right tools and equipment. And lastly, health and wellbeing, and that's what we'll be talking about predominantly today. So each of those aspects are measured. The data is also sliced and diced into 7 dimensions, the first 6 being typical behaviours you'd expect to see in a workplace. We'll go through some of those behaviours a little bit later. And the 7th dimension is around conditions in the workplace. So really access to the right information, the experience, and the psychological safety and conditions that people might experience when they are in the workplace. All that data is great, but ultimately what organisations are looking for is some guidance on how to improve. Many of our organisations are using the Health and Safety Index to drive high-performing cultures, but also inform strategy. So the 12 levers, and we'll go through some examples of what they look like, are essentially an aggregate of predictors of where to focus your attention to get the biggest bang for your buck. So I'll continue on and skip through the intro slides. What's unique? Well, I'm not aware of any other survey that covers the 4 aspects that we've spoken about today. And I'm certainly not aware of a survey that's used in industry at the moment that's been validated by a PhD with a reliability of excellent or over 0.9. The reason why we've spent the time to design this, and it has taken a lot of time to get this right, is that the intention is to use this data over many years to benchmark and provide people some credible data they can rely on time and time again to compare their performance over time. If you want to understand more about the importance of validity and reliability, today is not the day, but there is information on our website. This is not a safety culture survey. We believe culture changes over years, not weeks or months. It's not a surprise that engagement has been used by HR professionals over many years as a lead indicator to drive performance. So we're basically using that concept in a health and safety context. Just quickly, we also can tailor surveys to meet the organisational needs with specific demographic data, be it positions, division, location, etc., to help identify your hotspots or areas of focus. It is simple. Takes about 10 minutes, it's about 60 questions, and it provides organisations to put all of their feedback from the organisation in one consolidated place.
And just in terms of that tailoring, Mark, just to emphasise that certainly in terms of demographic coverage, we can include contractors and the like in the index so that you can have a holistic understanding of your risk profile in this space.
Thank you, Kapau.
No worries.
Over to you.
Excellent. So we understand that there's a large percentage of the audience are from a health and safety background. So no doubt a very large percentage of you are familiar with the hierarchy of control. So what we've essentially got here is the NIOSH model that has been adapted for health and wellbeing. Essentially, what we're finding when we're going into new clients, generally we're finding that they're not taking a risk-based informed approach. And the issue with that, or the challenge with that, is that when they're asked why they've focused considerable time, energy and effort and spend in terms of health and wellbeing strategy and programs, they actually haven't got an underpinning of risk and data that's actually driven those decisions. And so the issue with that is that those programs potentially have taken a lot of time, energy, effort and money, and they're not directed in terms of where the focus really needs to be from a risk perspective. And so we're brought in, we're asked to come in when they're challenged by high turnover, high levels of bullying, their site claims are going through the roof in terms of cost and duration and sheer numbers, where they've had high levels of team conflict, for example, and they're at a quandary to understand what are driving, all of these things and poor engagement scores overall. So what we certainly encourage is taking that risk-based approach and using the hierarchy of control to quantify and qualify the strategy in terms of it being a risk-informed approach with a 2 to 3 year roadmap, and prioritising and focusing on what really needs to be focused on and worked on from an organisational perspective, a team perspective, and then an individual perspective.
Yeah,
Thanks,
great.
Mark.
Great, Kate. And I think how that typically plays out in a workplace is that organisations often default to training or EAP for some of those lower order controls rather than organisational design, team effectiveness, and the root cause, if you like, of why they're coming up with some of the results they are. So I noticed that there is a Q&A, a question that has just come through. So Kate, I'll allow you to continue, and I'll just have a look at that chat as you continue to talk.
So just going through high level in terms of what appears to be quite a simple model there in terms of job demands, job resources, impacting, contributing to worker outcomes. So what we seek to understand, what we've sought to understand through the index is to understand what are the demands at an individual, team and organisational perspective bearing on employees. What resources from organisational perspective have been made available to employees to reduce those impacts of job demands? And if the resources aren't equipped or aren't at the level to reduce that risk, we see an increase in terms of worker outcomes. So things like increase around reports of usage of drug and alcohol, increased reports around fatigue and sleep challenges, sleep issues, increases of team conflict, task conflict, the high perceptions of level of lack of procedural fairness, poor results around consultation. So these three aspects of the model are integral to each other and impact interchangeably. Thanks, Mark.
Excellent. So as we go through, there is a question around another assessment tool that's been developed by a PhD graduate out of the University of Western Australia called the Perception Mapping Tool. So I haven't heard of it, but I'm very keen to have a look. So thanks for your input there. Okay, so let's get into some case studies and some real outcomes so people can sort of sink their teeth into this. What you can see on the screen here is a typical dashboard that's in our reports. And it's really mapping what I've spoken about before in terms of the consolidated result, top left-hand side of one index. Often boards and senior managers are really keen to track something very simple over time. And this is a great way to understand where you're sitting from low through to high performance. On the right-hand side, those 7 dimensions that I spoke about there, and you can see some of those typical behaviours, conditions and experience that provide you a really quick snapshot of what's working, areas for improvement and the relative difference. The aspects bottom left, again, from safety systems through to safety engagement, you can see the relative scores. We won't go through it today, but a lot of our reports will go into a lot of detail in and around taking those results to the next level to understand some of those specific behaviours and conditions that make up that score and outcomes. So the survey is designed with both inputs and outputs. As Kate indicated, there are a number of different factors around job resource and demands, in particular around health wellbeing, that impact on worker outcomes. So across those 4 aspects, we've designed input questions that inform the actual impact on the organisation, be it sleep, engagement, health wellbeing, adverse effects, etc., to give people some really tangible understanding of, I guess, cause and effect, or at least relationships between some conditions and behaviours and the impact that's potentially having on the organisation.
We've just got a couple of questions there that have come through, Mark, in terms of do we have a team of professionals that are specialists in musculoskeletal? So certainly in terms of the results that have come through, we are able to track the link between workplace health and safety and stress, and increase around reports of musculoskeletal type claims and incidents. And so that may well form part of a focus area for a strategy. If there's areas outside of that that specific mental health and wellbeing space where we've got that specialisation, we will recommend different providers to come in and assist in their area of specialty. So we certainly don't claim to be specialists across that whole realm. In terms of that strategy implementation, we'll bring in the specialist if and where necessary if we identify an area that's outside of our scope. And that's important as professionals, that we have a clear boundary about what we can and can't do.
Okay. So here we have a bit of a case study on the levers that have been identified across health and safety. Kate will go into a case study specifically around health and wellbeing as it relates to our consolidated results. The reason why we brought this up is just to give an indicator of what the health and safety index can capture. So as I've sort of indicated before, the consolidated results are sliced and diced into levers. Those specific levers are identified through a whole bunch of correlated data that provides the best predictor of whether you spend your time and your return on investment. This particular example is not necessarily the outcomes of what everyone has. These top 4 levers are specific to one organisation and their results. So those being values and beliefs, i.e. the impact of taking shortcuts, the values organisations have, how that plays out in the workplace around people's behaviour and pressure to compromise safety, communication and the effectiveness of having visible, effective conversations as senior leaders in an organisation, people being held accountable for walking past and not intervening where things are identified, and recognition is often something that comes up as an area for improvement. I think it's quite easy, and human nature often gets us to identify and go straight to things that aren't working, as opposed to focusing on things that are positive and giving people, some recognition and reinforcing some of those behaviours that we would expect. So I'm going to hand things over to Kate now and really delve into the health and wellbeing results and give everyone a bit of a snapshot of where things are at.
Thanks, Mark. So in terms of the findings that we've correlated over the timeline of running the Health and Safety Index, the findings are clear that in terms of the strongest indicators that contribute significantly towards providing a psychologically safe work environment, they are providing safe workplace conditions, having clear and set expectations that are clearly communicated, understood and measured, and ability to talk with supervisor. And so a strong sense of communication and trust between employee and supervisor and manager. In terms of the lower 3 indicators that have been reported through the findings, realistic time pressures, where people are feeling that that the demands being placed on them are unrealistic in terms of the time they're actually given to undertake tasks and duties. Poor change management, so effectively managing change, so being part of the change as opposed to change being forced or foisted on individuals. And so we know that the employees that feel communicated with, consulted, part of that process, they are empowered, and their ability to go from kind of pre-contemplation that change isn't needed to being part of that change as an active participant and actually a champion of it is critical. And praise and recognition. So however form that takes at an individual and team level, individuals need to feel that in terms of contributing to the impact on them as workers. In terms of the high-level worker outcomes that have come from the findings, for example, respondents reporting 2 in 5 are reporting that work is adversely affecting their health and wellbeing. And, I think it's pretty fair to say, mental health and wellbeing, there's been a really high level of focus and understanding of the critical nature of that, particularly with COVID, and how changing workforce has really impacted on people's mental health and wellbeing. So I think it's certainly taken that to a whole nother level, organisationally, individually, over the last 12 months. And concerningly, we've had 2.5 out of 5 participants reporting that work is negatively impacting on their sleep quality in the previous 4 years. And as safety and mental health professionals, we absolutely understand the link between that as an outcome and the ability to make safe and informed choices and the quality of an individual's mental health and wellbeing. So they're some of the key findings, and what we are able to do is provide, in terms of report structure and strategy, is what are the key things that are strongest reported across your employee workforce, what's working, why is it working, and leveraging off those results to drive change in the areas where there's underreporting or lower reporting in terms of employees feeling like it's being well done in the organisation. So, yeah. Anything to add there, Mark?
No, I think that's really good, Kate. I'm trying to multitask and answer a question at the same time, which I've just done on the screen, just by trying to save a little bit of time.
Yeah.
So thanks, Kate. So the next slide really is taking what Kate has said to the next level. As demonstrated in the previous health and safety example, here is a consolidated result based on all of our data for 220. So this is not what Kate and I are saying. This is what all of the industry is saying around what they believe the top levers are to influence health and wellbeing. So again, not surprising, values and beliefs is up there as one of the top levers. We haven't provided the exhaustive list of behaviours and conditions that support all of these. We just don't have the time, but we can share that at a later stage if people are interested. What I will say around the values and belief part is that often we're seeing a lot of organisations are scoring quite high around values and wanting to do the right thing. But there's a gap, that knowing doing gap between what people believe is important and right versus how behaviour actually play out in the workplace. So part of what we do is help organisations understand what are those blockers or enablers between what people want to do versus what's actually playing out. So the next lever there is job control. Kate's spoken a little bit about that already, but certainly job freedom, time pressures are coming out as some highlights around really having an impact on people's job control and how they believe it's affecting health and wellbeing. Trust in leaders, it's not an uncommon thing for people to say, health and wellbeing, one of the best solutions around health and wellbeing is to really ensure that the supervisor and the supervisor support and capability is right. And again, this is playing out in a lot of our results, in terms of the ability demonstrating genuine care and concern, the ability for supervisors to communicate, provide the right resources when they're needed, and change management. So we've provided a few more examples here because this is probably one of the most highly correlated areas around health and wellbeing. And you can see the 4 areas there around communication, a link between the job goals and the company goals, and a linkage between ensuring that people are actually feeling like they're a part of the organisational direction and vision. Consultation, again, not a surprise there when it relates to change management. And the other one that sort of plays out too is actions around resolving things in a timely manner. So as you might appreciate, if things aren't getting resolved or they're not meeting expectations of people, that can be quite frustrating and can lead to impacts on both the individuals and teams.
And that goes to trust too, doesn't it, Mark, in terms of that relationship? So trust from an employee to manager, supervisor perspective, but trust also from an organisational perspective in terms of we say we do, and And the bigger the gap between here are our values, here are our priorities, and what actually is done on the shop floor or the the front line, the bigger the gap there, the higher levels of mistrust within organisations in terms of employees are able to see through that. So if issues are being raised consistently around, key challenges for employees and low levels of controls in terms of going back to that hierarchy of control are consistently implemented, like there's just a conversation or there's an admin level resolution that is actually really not dealing with the root cause, that continues to impact on trust. And ultimately what that can do is drive underreporting and break down individual psychological safety and belief that the organisation is really on the front foot around providing a environment that is psychologically safe for employees.
Yeah, look, Kate, given that there is a high level of interest in this particular area in terms of practical takeaways, it's fair to say that solutions around health and wellbeing don't necessarily have to be isolated to health and wellbeing. What we are seeing, given that we do cover those 4 aspects around engagement, leadership and systems, is often there's an interplay between the 4. And to some extent, all of those 4 aspects, not all of them, but a lot of those behaviours within each of those 4 areas are related to health and wellbeing. So the formulas and things that we've used to map those behaviours as it relates to health, wellbeing and the other aspects helps us get a really good understanding of how that plays out.
Yeah, absolutely, Mark. And so that's why we're able to, once we've done the analysis, the survey, the review of the lead and lag indicators, and we've got a data-driven, risk-informed, quantified risk profile, we're able to come up with a number of recommendations that drive a risk-based strategy. And those is often one strategy can address several areas from a psychological risk profile. So it's absolutely correct to say that that the risk and the outcome is not as linear in the mental health wellbeing psychosocial space as it is necessarily in the physical space. So it's certainly a really interesting space to be involved in as it continues to evolve.
So, Kate, we've also got a couple of questions here too. I think we're going okay with time.
Yeah.
So I might just answer a couple of those. The first question is around how do we deal with confidentiality? So we do have a couple of different options for organisations to choose. Most organisations choose to use a generic link specific to their organisation. So we don't capture any information that can directly identify an individual. We do have some business rules around, particularly with smaller groups or teams where someone might be identified, but we just don't report on that. It's used as a consolidated piece, but we don't actively report on that when we provide the data visualization reports back to the teams. So it helps protect the individual's privacy. Another question, who responds? The number of responses and industries that have participated. So if you go onto our website, you can see some of the typical organisations that have been involved. So that has stemmed across construction, the event space, facilities management, and a whole range of other organisations that has, I guess, informed some of the results of what we're seeing today. Okay, some practical takeaways. So, Kate, over to you to summarise, I guess, some of the things that we've said today in terms of what that means in practice.
Excellent, thanks, Mark. So we've covered off in terms of the index, the background and how that's come about and what that measures. In terms of the model, the key focus areas around the job demands, the job resources, what are the behaviours that can be measured and quantified, what are the work conditions and the user experience of individuals within the organisation from a team perspective. the top 4 levers that the data is clearly telling us are drivers for providing a health and wellbeing organisation that does health and wellbeing well, are organisations that focus on values and belief, job control, so empowering individuals to feel empowered in the role they're actually employed in, that they've got choice and control to the level that's appropriate. There is high levels of trust, psychological trust in the leaders within the organisation, and it's a safe place to raise health, safety and health and wellbeing issues and challenges. And to trust, it goes to action actually being undertaken in line with issues that are being raised. And change management is, as Mark said, one of the key levers that's become really evident. Organisations that do that well bring people in right at the beginning of that process in terms of that pre-contemplation space of getting them engaged around the why and the how of the change, and making them part of the solution, consulting throughout, and empowering individuals to be active participants throughout that, and then aligning those levers into taking the hierarchy of control approach in terms of the risk-based, data-driven profile that has been provided for the organisation, and where and how you're going to get the biggest bang for your buck in terms of eliminating high-level psychosocial risk or health and wellbeing risks, and taking a really considered risk-based approach that is understood by employees why different risks are at different levels of priority over a period of time.
Yeah, thanks, Kate. And I think some other practical takeaways to complement what Kate is saying around health wellbeing is applying some of those principles Kate spoke about in actually delivering the survey as well. The mere act of going to your organisation at scale and asking for feedback is a great way to engage your organisation. So we spend a lot of time with organisations preparing them with the right communication, getting the message track right, and our turnaround time, we commit to providing results so you can give meaningful feedback in a timely manner, and then demonstrate that you've actually taken on board the feedback and done something. And there's nothing worse than getting people involved in providing feedback and the response is really slow, or you're getting some response, but you're not seeing any demonstrated change. So really coaching your leaders to be able to take that on board and show positive, quick turnaround and meaningful action is really key to getting meaningful results and value money out of this process.
And it continues to build trust.
So Sarah, we have another poll. I'll hand things back to Kate to read that out.
Okay, so in terms of what we've covered today, question there around, do you see benefits in using the Health and Safety Index for your organisation? So a couple options there. I'll just let those answers come through.
So Kate, as you are just waiting for those results, we recognise there are other consultants out there in the marketplace. One of the reasons why we've set up the Health and Safety Index as a separate brand and organisation is that we actually want other consultants to use it. Okay, so we're not being selfish. We actually want this to be a tool that can benefit industry. So, if you are a consultant listening and you think that this question may not apply to you, there is an opportunity for you to make contact with us, still maintain the relationship with your client, and we can just be in the background and to support you with whatever you need.
And that's key. I mean, the whole of the FIFO team are, absolutely committed to reducing risk, whether that be from a physical or psychological perspective within organisations. So anything we can do to help, and if that means getting the index out there to other consultants, then that's part of that.
All right, I think we've got most of the people voted, so I will close that one off now.
Thanks, Sarah.
Okay.
Okay. So Sarah, just to double check, are you going to display the results, or is that something that we can sort of pick up a bit later?
I can if you like, but I think it's because it wasn't an anonymous one. I think
Okay.
I'll just share that with you later.
Okay.
Are you keeping track of these questions? Because
maybe you can help us there, Sarah. We will have question time at the end. I've tried to answer most of them as we've gone along. There is another question here. What assessments of data do we use to derive the outcomes around algorithms, machine learning, etc.? So, look, it's. I mean, that's a really big question in terms of how we've gone around designing those questions to come up with the outcomes. Around the health wellbeing space, I guess the really simple answer is we've used a research-based approach, not too dissimilar to what Kate's spoken about, to really understand the difference between job demands resources as inputs and then the output questions. So I could probably bore you senseless with a whole bunch of information around that, but that's probably a simple response for today. But look, if you want more information, more than happy to discuss that after the call as well. So in terms of additional information, research and resources, we do have a research and resource page on our website. People can get information. We are also committed to helping organisations and doing that in the right way. We don't have an endless supply of capacity, but what we are offering is 5 organisations the ability to be involved in a 60-minute strategy session. So that could be using the outcomes of the index if they choose to use it, or if not, just a strategy session on improving health and safety across their organisation. So there's an email address there. If you'd like to use that, feel free to reach out, and we're more than happy to sort of chip in and help out where needed. If that's not for you, that's fine. We also have a subscription to an email that comes out, a newsletter that comes out every 8 weeks, and that's packed with the latest industry trends, snippets of the health and safety index outcomes, and from time to time we've also got different offers too. So we have recently formed a partnership with Paramount Safety Products. I appreciate that's not the topic of the conversation today, but that there are things and offers out there that we're more than happy to sort of pass on to our clients if and when they believe that's of relevance. So Sarah, that's it for the presentation today. I'm mindful that I may not have answered all of the questions, and there could be a lot more too. We've got a question on cost. So the $1 million question on cost, we've actually made a conscious effort to make this as accessible as possible. So there's 3 levels of assessments for the index. The highest level and the most expensive level is $1,800. So $17.99 to be exact. That's almost a daily coffee. It's pretty affordable. For those organisations that are price sensitive, we're able to put in demographic data to give you a really good snapshot across your whole organisation, regardless of the number of employees you have, regardless of the number of divisions. For those organisations that are a bit larger and are less price sensitive, we have had organisations that say, you know what, that is damn cheap, give us 6 of them. Because we've got such a large organisation, we want to be able to tailor the message to each of those divisions that are relevant to them. And again, for a large organisation, 6 by $1,800 really is not a lot of information, a lot of money. With the understanding, what we really want to drive is action and improvement, not spending a whole heap of money on trying to come up with the current state or gap analysis. If you can then divert resources to what matters most, that's where I think you're going to start to make some difference. Okay, we've got some more questions coming through. I'll try to do my best to answer those. Oh, I think I've answered that one already. Sarah, is there any other questions that you can see that I may have missed?
I don't think so, because Mark has just said you've answered all of his. So
oh, great.
I don't see any others. So all good from this end. I will just pop a link to the upcoming events in the chat as well. And hopefully that was very interesting, Mark and Kate Kapow. Hopefully we can organise another topic at some point in the next few months.
That would be great.
More than happy to help. I mean, today was on health and wellbeing. We've got lots of other interesting insights that we can sort of delve a little bit deeper into, you know, depending on what people might want to hear.
Yeah. All right. Well, I've just shared that link in the chat for any our upcoming webinars. We've basically got the next 3 or 4 months filled out, so there's a lot of various topics coming up. Thank you, Mark and Kate, for today. That was fantastic. We will put that email address in the email that goes out later today with the recording and the podcast, so people that can share that as well if they like. So thank you very much for joining us.
Thanks, Sarah. Thanks,
Thank you.
everyone.
Okay, guys. Bye.
Excellent.
See ya. Bye.